Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapano.
Good evening. Thank you for joining us. This is Sports Doctor. Tonight we're brought to you by Cross Keys Physical Therapy Sports Medicine Center. They're in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro, offering free screenings for the next 2 weeks. During the program, we'll give you numbers to contact them to take advantage of that offer. Tonight we're going to be talking about general sports injuries, really injuries to the shoulder and knee or anywhere in between. Our toll-free number is 1-888-634-7488. If that is something you're dealing with and you have a question about your own condition, give us a call. We'd love to hear from you tonight. Answering your calls, we have Dr. Thomas Duffy. Dr. Duffy is an orthopedic surgeon. He's also an assistant professor of surgery at UMDNJ, and he's also the team physician for the Camden River Sharks. Next to him is Dave Anselmo. Dave Anselmo is a physical therapist and the owner of Cross Keys Physical Therapy Sports Medicine Center. Again, our toll-free number is 1-888-634-7488. We welcome your calls about general sports injuries. And while we're waiting for them to call, Dave, why don't you talk about people who are starting to exercise for the first time, getting that soreness, is that normal, and how can you tell if it's something that someone should look at?
Well, first of all, I always like to say I think it's highly recommended for anyone who has not participated in an exercise program for 6 months or longer to go see their family physician first, just to clear any underlying factors that may limit their ability to participate in an exercise program in a safe fashion, whether it be soft tissue, orthopedic, musculoskeletal, cardiovascular. All of the above could cause a problem, and you don't want to start something and not be sure that you can participate in it in a safe fashion. Saying that, now let's get to the soreness thing. Soreness is very normal when you first start an exercise program. I'm an avid workout person. I work out 5-6 days a week. And when I go on vacation for 1 week, when I come back, I start exercising again, I'm sore. But it's normal to have this soreness over a 5 to 7 day period of time after you get through your first week. But that soreness should decrease over that next 5 to 7 days. If it doesn't, if it increases, it turns into a sharp pain, a tingling pain, a burning sensation. Well, then that throws up a red flag to me that something is wrong. At that point in time, I give the people usually two choices. Either one, either shut down the exercise program altogether and go see your family physician right away, or shut it down and wait a week and see if the symptoms go away. If the symptoms go away, well, then more than likely it's one of two things you did. Either you did too much weight too fast, or you did it, your technique of it we're working out is improper, body mechanics is improper. So I recommend at that point in time you either see a physical therapist or see a personal trainer or athletic and care trainer to show you the proper way of working out. You're doing something improperly. If you go back and do that and you don't have no symptoms, you're fine. If you do, go back to see your doctor.
All right, our toll-free number, 1-888-634-7488. Let's talk to Robert in Pottstown, our first caller tonight on Sports Doctor. Robert, go right ahead with your question.
I had an MRI done and just recently, and I have to go see an orthopedic surgeon. I have multiple pinched nerves in my neck and down into my C and 3/4 vertebrae. What can I do for it?
Okay, multiple pinched nerves, Dr. Duffy.
Well, the orthopedic surgeon should give you a good exam, find out exactly what's wrong, take a good history in terms of are you having pain down just in your neck, or is it going down into your arms? If that is the case, and the MRI does show some pinched nerves or herniated disc, options that you do have, one would be some physical therapy, which would help try to get the muscles stronger in the neck and stabilize the neck that way. The other next option would be to consider the possibility of some injections by a pain specialist, an epidural injection or facet block injections into the area to try to decrease the pain around the nerve roots, and hopefully that way decrease the pain that goes down your arm.
All right, Robert, thank you for the phone call. Let's talk to another caller, 1-888-634-7488. It's Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center, and we're talking general sports injuries. I believe we have Dave on the line from Ventnor. Dave, go right ahead with your question.
My question?
Yes, go right ahead, Dave. I think we may have lost Dave. All right, and a reminder too: if you are calling in, make sure you turn down the volume on your TV set because you'll hear us through the phone. If not, it'll get a little confusing. Let's talk to Tom in Blackwood. Is that right, Tom? Go right ahead with your question.
Hey guys, how you doing?
Good. How are you?
Good. Hey, I'm having trouble running, and I don't know what's going on here, but my fuse is too low.
Something with the knee. Is that what he's saying? Is it if you have sharp pains in your knee when you're running? Is that something that should be looked at, or is that something you should try to work through?
Well, if it really continues, I mean, if you have to slow down when you're running and or change how you're running, and it still continues to bother, then it really should be looked at. You have to look at what type of sneakers you're wearing, what the quality of the sneakers are. If you've had them a while, you really should consider changing the inserts. That may be a good quick fix to get rid of the pain in your knee. Other reasons that you may have pain is where you're running. Are you running on a treadmill, or are you running out in the street, or are you running on grass? A treadmill or grass or a padded track is much better on your knees than the street. So,
what about this, Dr. Duffy? Someone has done too much too soon. What can they do at that point to help themselves?
Again, like what Dave said, is really try to cut it back and bring it back down. Don't go keep trying to run right through it if you're that sore. Take a day off or two. Start back more, breaking into it with lower mileage, slower time, walk and run in a combination. Again, the biggest thing too is you got to stretch before and after you run. Very important to stretch after. A lot of people just walk down, cool down a little bit, and then they just pack up and they go home. And that's not the best thing to do. You really need to stretch those muscles out after you've run, and that would really help.
All right, back to the phone lines, and I believe we do have Dave from Ventnor this time. By the way, our toll-free number, 1-888-634-7488, and we're talking general sports injuries. Dave, if you're there, go right ahead with your question.
Yeah, my question is, I had an Achilles injury. It was a little sensitive at first, but I've had other minor ailments before. I just played through them, frankly. I've got an athletic background, and frankly, I'm not timid. But this time I went ahead and made a move on a tennis court. Didn't fall, but when I made the move, I felt it go from my Achilles all the way up the back of my leg, the tendon, all the way up to and in back of my knee. And that put me out of commission about 5 weeks ago. And I'm trying to get back into, I guess, the therapy end of it right now. I'm trying different braces on my ankle. The leg tendon seems to have subdued a little bit, but I still have the sensitivity in my Achilles. So I just really need possibly some kind of therapeutic advice.
Okay, I guess this guy wants to continue with his activity, which sounds like tennis, and had an Achilles problem. It shot up to the knee. What are your thoughts for this guy, Dr. Duffy?
Well, it sounds like if you can strain the Achilles, and the Achilles tendon, it's the gastrocnemius muscles and soleus complex comes down into the Achilles tendon. So when he's pulled at the Achilles and strained the muscles all the way up, and muscles attached to the back of the thigh bone through the knee. So that's why it hurts all the way up. It can be very painful, and it takes some time. You need to wear, a lot of times it's a compression sleeve or something like that initially to help keep the muscles stabilized and compressed down and keep the swelling down. And then it's the therapy afterwards. First is being able to walk again without pain, but then it's a lot of stretching exercises initially to get the Achilles tendon and the muscles working again, and then strengthening. So it's a combination of things to really work up getting back onto the tennis court or any activities.
About how long are you looking at in rehab for something like that, Dave?
Well, obviously, like the doctor said, first of all, you need to be assessed by the doctor first to find out what type of degree of injury really was. Different levels, obviously, if it's a real minor, that it's going to be faster than if it's something more severe. It sounds like his, because it went all the way up to his back of his knee, it's probably going to take a longer period of time. But somebody like himself, I really got to work on, like the doctor said, you really need to work on your mechanics of walking again and really work on flexibility and strengthening of that thing. And I highly recommend someone like that, especially the lower extremity, to get yourself involved in some type of aquatic therapy program. Because at this point in time, you're not really putting too much stress on the joint, and your Achilles is as much, and you're able to work on your mechanics of how to properly walk again. The therapist will be able to work on your proper body mechanics of walking and stretch you a lot more easier in the water and start your strengthening program at a sooner period of time without putting compressive forces on that joint. So.
All right, Dave, thank you for the phone call. Our toll-free number, 1-888-634-7488. We welcome your phone calls tonight. We're talking general sports injuries. I believe we have Bill on the line from Philadelphia. Bill, you're on Sports Doctor. What can we do for you tonight?
Good. How you guys doing?
Good.
Good. I had a general question. My daughter's 11 years old, and she's very active in sports. She plays soccer, softball, and basketball, and she's been having problems with her left heel, kind of on the bottom, towards the back, and where it rounds on the bottom part. It's just a general pain where she's always running, she's always on her feet, and it's kind of hard. My view on it's kind of hard to really to rest that when you're playing 2 games a weekend or 3-4 games a weekend. So I was wondering. I was going to have her go get it X-rayed, and maybe it's a spur, or I don't know what it might be for an X-ray.
Well, obviously, I think we agree that she should probably see someone. But
Absolutely.
But what type of conditions could symptoms like this be indicative of?
Well, it could be. I mean, she's very active, and she's doing multiple sports at the same time. And some of these sports, you're using the muscles differently, which can be an overuse type injury, which is what it sounds like. Also, if she's been growing recently, it could be an issue with that too, is with the pull of the Achilles tendon on the heel, and the growth plate there can really cause a problem. It's something called Seaver's disease. And what you need to do is she needs to get an X-ray to make sure there isn't anything wrong, and at least try like a gel heel cup into her shoe. But the best thing really, and I'm sure it doesn't sound like your daughter would like that, but she really needs to take that rest and not play the 3 or 4 games the weekend for a little bit until this pain calms down.
And that would be the way to rest that, is not to participate in those sports until the pain subsides. Our toll-free number, 1-888-634-7488. We welcome your calls tonight. This is Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. Don't forget, they're offering free screenings for the next 2 weeks, and to take advantage of that offer, call the center nearest you. Again, in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, Swedesboro. The numbers are on the screen. We're taking a short break. We're coming back with more of your calls. If you have a question about a sports injury you have right now, our toll-free number, 1-888-634-7488. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
All right, this is Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. Talking about general sports injuries, taking your phone calls, our toll-free number, 1-888-634-7488. Answering your calls tonight, Dr. Thomas Duffy. He's an orthopedic surgeon. He's also an assistant professor of surgery at UMDNJ, also team physician for the Camden River Sharks. Next to him, Dave Anselmo, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. On the phone lines, we have Gene from Maple Shade and also Earl from Chester. Let's talk to Earl first. Earl, if you're there, go right ahead with your question.
Hey, how you doing, fellas?
Good. How are you?
Doing real good. Hey, listen, love the show. Watch it, as often as I can. I started doing a new workout called combat training. I don't know if you're familiar with it. Hindu squats, Hindu push-ups, and back bridges.
Okay.
And I have a real, I'm getting great results from it, but my Howard Stern and Baba Booey is actually hurting me. So I wanted to see if you could help me out with that.
What is this boxing that's being done? Is that something that anybody? I mean, is that for anybody, or would you have to have a physical screening before you participate in that? Or
again, like Dave said in the beginning, depending on your activity level, trying to get into this combat training or the boxing, you really, if you haven't been active, it's not something that you should just jump right into. You really need to be something that you should be working out and in some physical shape before you start this, or break into it slowly, because you could hurt yourself if you don't do it properly.
Let's grab another phone call. Gene from Maple Shade. Gene, go right ahead with your question on Sports Doctor.
Hi, I've been diagnosed with a number of things. I have osteoarthritis, osteoporosis, both hips are degenerative, two degenerative discs in my lower back, sciatica, and the main problem is wrist. I have a spinal stimulator, and other than that, I haven't gotten any relief or any options of other medical treatments. Is there anything else out there?
Okay, it's kind of an involved question, Dr. Duffy.
Well, you had the spinal cord stimulator for the pain in your back. Have you had you've had the injections in your back as well?
Yes. Yeah, the epidurals and the other one, I forget what it's called. It only lasts about a month.
Right. I mean, you have a lot of things going on. It's a tough combination with the degenerative disc disease and the osteoarthritis. I would think that your last option would be surgery, and I'm not sure if that really is the best option for you. The chronic pain management may be right now the best, and some therapy to trying to keep your back and your core as strong as possible in order to try to alleviate some of this pain and stabilize that area. But you've obviously seen the pain management people if you had the stimulator and all that. So if it continues or you start getting more of the pain down your leg, the next option would have to be, and unfortunately would have to probably be surgery.
But Gene, have you had any therapy at all?
Is she still there?
Gene, are you there?
Yes.
Okay. Have you had any therapy at all?
Yeah, we saw the doctor, and pretty much he was just telling him to stretch his legs like twice a day. That's it. And he said, continue to play soccer, just take it easy. But he just goes regularly through the practices and to the games, and it seems like it's taking 2 years. The knee is not going down yet, and I don't know how long that.
You're not Gene. You're Tayuda from Philly. That's okay. Tayuda, why don't you finish up with Gene, and then we'll come right back.
For Gene, one concern I have with Gene is she has a lot of pain, and if she didn't have any therapy at all, with the history she had, she has a little osteoporosis. It's a concern, and my concern with her is you really want to get involved in, once again, a water program. You heard me saying it earlier, because you really don't want to compress that area too much. You want to really be careful with how much stress is applied to that spine at this point in time. So you want to get involved in a water therapy program where you can help to decompress that area and hopefully open up that space and give you some relief. And when you get into it, you want to get into somewhere that really knows what they're doing when it comes to that, and the therapist is getting into the pool. So if you live anywhere close to any one of our 3 centers that has the water therapy, please take advantage of our free screening so we can go through some of the ideas and tell you what we could do for you, and hopefully we can get you some relief.
And the centers with the aquatherapy, I know Woodbury.
Woodbury, Washington Township, and Pennsville.
Okay, so there you go, Gene. Thank you for watching. Thank you for the phone call. There's the numbers for the various centers of Cross Keys Physical Therapy Sports Medicine Center. We started to talk to Tayuda in Philly. We thought she was Gene in Maple Shade. It was a little confusing. Tayuda, why don't you start from the beginning? What's your question for us tonight?
Okay, my son, he's 13. He plays soccer. He's been having that. He has that Asgard-Schwaller disease.
Asgard-Schwaller. Okay.
Okay.
Hello.
Yeah.
He's seen the doctor, but he's saying that he can continue to play soccer, but just take it easy and stretch his leg, like trying twice a day. That has been going on like for 2 years, and we don't see too much improvement. And I don't know if just continuing to play soccer is making it worse, or.
All right. What about that, Dr. Duffy?
I think your feelings after 2 years are absolutely right. I would if your son was in my office, I would tell him that he's not playing soccer until he's pain-free. He needs to stop playing the soccer, stop running, not even taking gym class if they're running in gym, and totally shut down that knee, only walking until he's pain-free, and then he can start in a running program after that. And once he's, if he starts running again and he's fine, then he can get back into his activities. But I would stop all soccer and any running sport altogether.
And what is the deal with Osgood Schlatter, is that something that children outgrow, teenagers, or is it
Usually
something?
it is. Usually it's a growth plate at the tibial tubercle that has not ossified yet. And again, it's the pull of the patellar tendon on that area that gets inflamed, and the patients have a lot of pain. And the only way to stop it is to stop the offending sports and the jumping and the running with the soccer or any sport like that. You have to. It's tough because a lot of these children that get it, they're active. They want to play. They're playing 3 sports. They want to do all this stuff, and they can't. And it really, the best way to do is to shut them down.
It's hard, I know, but sometimes you have to do that. Our toll-free number, 1-888-634-7488. You're watching Sports Doctor. We're taking a short break. We're coming back with more of your phone calls. Also, I want to remind you about the free screening offer from Cross Keys Physical Therapy Sports Medicine Center. To take advantage, call a center near you. There are the numbers: Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. Taking a short break, coming back with more of your calls. General sports injuries tonight on Sports Doctor. Stay with us.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Some of the best athletes in the world play for the teams of Philadelphia. And when it comes to sports injuries, they put their trust in the #1 orthopedic care team in the Delaware Valley. The Rothman Institute. The best professional athletes trust Rothman. Shouldn't you?
Sports Doctor, we're brought to you by Cross Keys Physical Therapy Sports Medicine Center. I want to tell you about our guest, first of all, Dr. Thomas Duffy. He's an orthopedic surgeon. He's also the assistant professor of surgery with UMDNJ, also the team physician for the Camden River Sharks. Next to him is Dave Anselmo. Dave is a physical therapist and also the owner of Cross Keys Physical Therapy Sports Medicine Center, located in Woodbury, Washington Township, Pennsville, Vineland, and Swedesboro. We're talking general sports injuries. Our toll-free number is 1-888-634-7488. Love to hear from you tonight. We have Debbie, our next caller, from Washington Township. Debbie, go right ahead with your question on Sports Doctor.
Thank you. Hi. Thanks for taking my call. I had a question about shin splints. I've been in karate as a beginner for the past 2 years, and I'm looking forward to doing extensive training the next 8 weeks to earn my black belt. But when I run and do jumping jacks, my shins are in so much pain, and I don't know. I know I can ice them, but what else could I do for them other than putting ice on them?
Okay, the complicated issue of shin splints.
Again, really, you need to stop the offending problem. The running is probably the biggest problem that you're having and causing the pain. Having better insoles in your sneakers would help. With good arch supports, if you have somewhat of a flat foot, that may help relieve the pain. But really, you're going to have to stop the running altogether until you're pain-free. You can do the stretching, and the icing will help, anti-inflammatory as well, on a regular basis. And then once you're pain-free with walking and going up and down stairs, then you can start the jogging again. But I would stop the jogging altogether.
What about stretching and shin splints, Dave?
Well, I think it's very important, as the doctor nicely explained. You really do need to shut it down because the inflammation gets so bad, especially if it's that long period of time. And I know with martial arts, I do it, my wife does it, and it's very aggressive, and you do a lot of jumping as well as running around and kicking on one foot and the other foot. It's real stressful on your lower extremities and your feet. So you really need to get involved, and you really need to stretch before, and you need to stretch after you do your involvement with your martial arts. After you get done your classes, you need to stretch, and you need to ice them down. But at this point in time, it's getting as bad as you are and getting ready to get into a real involved 6 weeks of hard training. You really need to shut it down so you'll be able to